Hey guys, in today's video, we're going to be going over 4 ways in which facial bone loss contributes to facial aging. If you are new here, welcome. My name is Andrea. I am a board certified dermatologist. If you like skincare, anti-aging tips, skincare product reviews, consider subscribing or follow me over on Instagram or TikTok. I post on those platforms a fair amount as well. Now, when people think about facial aging, a lot of times they're laser focused on the skin. Don't get me wrong, the skin is your largest organ. It's a barrier to the outside world. People focus on improving wrinkles, fine lines, sunspots, but often fail to recognize that we have age-related loss of the bones in our face, and that too is a major driving force for loss of volume and redistribution of soft tissues. Think of the bones in your face as a scaffold in which the skin, the fat, the muscles are all anchored. And as you start to lose bone in selective areas, that can lead to sagging and redistribution of fat, everything kind of shifting downward. As you have loss of this supportive scaffold, for this reason, getting a facelift, skin tightening procedures alone oftentimes doesn't quite cut it in terms of yielding a youthful, radiant, natural appearance. For this reason, aesthetic procedures not only have to address volume loss and redistribution, but they also have to address the scaffold. You can't just go tightening and filling haphazardly. You have to think about, where has this person lost volume in their bony skeleton? You know, the bones of our face are interesting. They're much different from the bones on the rest of our body in terms of how they form, but like bones on the rest of our body, with age, you do lose bone mineral density. But to what extent you lose bone mineral density in the bones of your face, it actually varies quite a bit from person to person, from gender to gender. Unfortunately, ladies, we lose bone mass much earlier than men, especially around menopause. It also differs with ethnicity and race. It's not as though every bone in your face loses bone mineral density to the same degree or even at all. It tends to be focused in key areas. You get selective loss of bone in the bones around the nose, the mid-face, and around the eyes. And as you lose that bony supportive framework, well, the craniofacial skeleton, it starts to kind of have a downward and inward rotation. And this results in displacement of volume from the mid-face down to the lower face and the neck. You know, in a youthful appearing face, it almost looks like a heart with the majority of the volume in the mid-face. But as you lose bone and you have weakening of ligaments and redistribution of tissue, all that starts to shift down. Recently, I did a video on how your face changes with age. In that video, I pointed out that a underlying component of how your face changes with age is not only the skin and the bones, but also redistribution of fat and weakening of some ligaments, and that ultimately leads to sagging. And all of those different components, they age at different rates. So it doesn't all happen at once. I'm telling you guys this because not everyone experiences facial aging at the same rate, to the same extent, in the same way. These are common patterns, but they happen at different rates in different people. And for that reason, when you go in for an aesthetic procedure, consultation for rejuvenation, they're going to take you as an individual into account. Number 1 is the bones around the eyes. This is actually some of the first bony territory to start to dwindle, and where we start seeing the visible signs of facial aging first is actually around the eyes. You lose bone in around the orbital rim. So if you touch around your eye, you'll feel there's a bone here, the eye socket. And that actually gets wider with age. And the result of that, you might think, is that your eyes get bigger, but it's actually the opposite. As you start to lose bone around the eye, what ends up happening is, again, it's a scaffold. So as it starts to expand outward, well, that skin that was previously being stretched by that bone and held there in place starts to sag. Because of that, you may start to notice hooding of your eyelids, prominent under eye circles, hollows, tear trough deformity. Losing bone from the upper part of the orbital bone, that plays a role in how the brows start to droop. When you lose bone from this part of what's called the orbital rim, well, that starts to affect your cheek, and you get cheek flattening, pulling things down. You can get a prolapse of that fat pad, malar festooning, prominent under eye bags. The skin under the eyes at baseline, no matter what age you are, is very thin. So when you start losing bone in this area, that skin gets stretched. You have more obvious dark under eye circles. You can start to notice hollows. And that leads to not only dark under eye circles, but a prominent tear trough deformity. And with all of this drooping, the eyes actually start to appear smaller. The eyeballs are not actually changing in shape, but because everything is shifting around, your eyes start to appear smaller. That was one of the things I pointed out in my recent video on how your face changes with age, is that the eyes do become smaller. So it's that widening of what's called the orbital aperture, and everything just kind of starts to sag. And that also, again, affects the cheek anchoring, flattening the cheek, bringing the volume down low. In a more youthful face, you do have a lot more volume here in the cheeks that's anchored there by, and partially by the bone here around the eye. And so as you start to lose that bone, you get an increase in the distance between that orbital rim and the cheek. So you kind of lose that smooth contour and it flattens out. And as it flattens out, it kind of has the effect of changing the overall face shape from a more heart shape almost to a rectangle. All right, number 2 is bone loss in the mid face. Specifically, there is a bone here called the maxilla. It's basically where your teeth, your top teeth are hooked in. That's the area of the mid face where you lose the most bone. And what ends up happening is that the angles around the skeleton, they start to shorten. As you start to lose some of the bone that makes it up, it actually retrudes, meaning go backwards. You've heard of protrudes coming forward, retrude going backwards. As it does that, the angle, it's called the maxillary angle. You can see it here on this image. It actually starts to decrease. It decreases by about 10 degrees from age 30 to 60 and above. Now the cheekbone, fortunately you don't experience a ton of bone loss there, but you do experience some, most notably on the more lateral aspects. So you can see how that's also going to be a point of anchorage that is lost. But as that point of anchorage is lost, that's going to contribute to kind of a flattening and sagging. So you lose some of the definition of your face and some of the smooth angles, and you get more of just kind of a square appearing face, square rectangular appearing face. Number 3 is the bones around your nose, the perinasal bones. In that video about how your face changes with age, remember I told you that your nose actually appears longer and the tip of your nose droops. And some of that is due to loss of the supportive framework, weakening of the ligaments that attach around there, but also the bone. Now, it's kind of hard to picture the bones around your nose without looking at a skeleton, because your nose is mostly cartilage, but here we're just talking about bone. If you just look at the bone, you have something called the piriform aperture, kind of like your eye socket, but for your nose. Just like in the eye, loss of bone here makes that piriform aperture widen. And the end result of that is that the nose, it elongates and starts to droop. There's also a little bone kind of inside your nose where what's called the columella anchors. And as a result, you get kind of a retraction of that further leads to droop of the nose. So the nose looks longer and wider. We talked about how in the mid face, you get a decrease in that maxillary angle as that bone is being lost. And that ends up paired with the loss of bone around the nose. The end result of that is you get a deepening of the nasolabial groove here. So that's why that becomes more obvious with age. It has to do actually with loss of that anchorage around the nose and in the mid face. Those bones being resorbed, well, it has the effect of deepening this crease here, the nasolabial fold. Number 4 is bone loss in the lower face, specifically the jaw. This bone here is called the mandible. And when you're younger, that bone has a nice sharp angle, almost looks like a hockey stick. With age, the bone decreases in height, widens that angle, so you lose the hockey stick acute angle and it widens. The result of that is that your chin doesn't protrude as much, kind of goes inward more so. And so that has the effect of just losing overall definition between the jaw and the neck. And plus, you've got everything up here aging and coming downward with more volume being shifted to the lower face. The length of the bone decreases and the height. So the end result is that you get an increase in that angle, so you lose that nice hockey stick shape. And then the chin kind of retracts a bit, so you don't have as much of a nice sharp angle with the jawline, or as prominent a chin projection. The changes in the jawbone, as well as the bones around the nose and in the mid-face, lead to kind of sagging in this area and formation of what is called the pre-jowl sulcus, or the pre-jowl area. Just a more notable groove here. This is absent in a more youthful face, and it's very smooth. You have a smooth transition here from cheek to mouth, whereas with age, you've got pulling downward, plus you've got loss of volume around this area. All right, so those are the 4 key areas of the face for which you have bone loss. How can you slow all of this down, change it up, keep it from happening? Truthfully, healthy lifestyle factors are the main thing. Don't smoke. Don't drink alcohol in excess. The reason this is important is that these are factors that do affect the health of your bones long term. So that's key, you know, taking good care of yourself, eating a balanced diet, getting plenty of exercise, good quality sleep, all of those things I talk about in all of my videos are gonna be key for bone health, including the bones of your face. But honestly, at the end of the day, a lot of it just comes down to your genetics, your anatomy, and what you start out with. For some people, they just age better, and you could attribute it to their genetics, but it has to do sometimes with their bone structure is just stronger. They have a stronger jawbone, they have a stronger cheekbone. If the bones of your mid-face are small, these changes are gonna be more obvious at an earlier age. If you don't have as defined a jaw, well, volume redistribution is gonna be more noticeable and it occur at an accelerated rate into the lower half of the face. There are things like bony implants that can help anchor the tissues and restore a more natural, youthful appearance. In combination with placement of fillers, this can really restore a more youthful, natural appearance to the face, as opposed to just straight up skin tightening or a facelift. I wanted to end this video by showing you guys this image here of a skull, and the arrows are pointing to where on your face you lose bone. And the size of the arrow corresponds to how much the extent of bone loss that happens. So the bigger the arrow, the more bone loss you're gonna have in that area. And you can see where bone loss is more striking, and the end result of that is you lose that anchorage, and that's really kind of what starts the downward slide, quite literally. Think of the bones in your face as a command hook shelf. Have you ever had one of those? I used to have one behind me. You'll notice it's absent. With time, I found that the adhesive on those, they weaken, they give out. Maybe it's the humidity here, they just don't hold up well. And once that anchorage support of that adhesive goes, well, everything starts to shift down. And in the case of those shelves, it shifts down very quickly. It's a lot more gradual when you're talking about the aging face. But anchorage is just as important as skin, fat. I mean, it all works together to result in the way your face looks. So if you're feeling as though with age your face has really changed, I hope this video was informative in pointing out the areas of the bone that are lost. Later on this week, I'm gonna go in depth into 3 key areas of the face that undergo change and are targets of aesthetic rejuvenation. So make sure you check that video out if that is of interest to you. On the end slate, I'm gonna put my recent video on how your face changes with age. So check that one out in the meantime if you missed it. But if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.